Over to Ms. Thavichanh.
Right. Thank you, Mr. Andrew. Yeah, the second question also very interesting. When keeping in mind that no health, no wealth, then it's really challenging for each government to achieve the sustainable and inclusive development. But, I mean, there would be any question whether to invest or not in quality health system, infrastructure, and services. But perhaps the question will be more away from the fund and how much and how to invest in the healthcare. Perhaps I think these are most important questions that each government may think about that. At least Lao government, yeah, because we have a budget constraint and it's difficult for us to fulfill the healthcare policy. Even of course, the government gives very important to the health of the people. So I think it is not unique to Laos. It's for most developing, or even in ASEAN, especially for CMV countries, state members, for the to investing to have good preparedness for the possible future pandemic. So in the past, of course, Laos also received very the car assistance from the bilaterally and internationally from different partners, international organizations, which is very thankful for that. But of course, we cannot live ourselves this way. We have to think seriously how to be self-resilient in the future. So I reaffirm that government alone cannot fulfill this job. Fully. So we need private sector to participate in the provision of the good healthcare service and infrastructure. And one of and a measure that we are working on now, our Ministry of Health is working on the health tax on some unnecessary goods like tobacco products, liquor, sugar content drinks or food. We anticipate that it would be a source of the fund that we can finance the investment in healthcare. And another thing, I personally think that maybe we have emergency environmental or disaster fund, emergency fund, but maybe it is also worthwhile to think about health fund for pandemic, especially for pandemic. Could be at global or regional or national level, which can somehow to fund the needs in the healthcare in the future. And other than that, we also think about working on the social welfare fund and environmental fund, which has strong correlation with the people's health. So something that interesting, but I'm not sure, I cannot really deeply to explore. But at least in principle, we may think about exploring this area to derive the fund for the healthcare sector as well. Other than that, I think stimulating private sector involvement in ensuring good health of the community through promoting CSR, corporate social responsibility, also very important. We also do, recently also do a lot with our, private sector in promoting CSR in different fields, not only in healthcare, but also in tourism, in agriculture and also in processing industry, so on and so forth. And last, okay, maybe one before last, promotion of green industry, forestry, and ecology protection, tree plantation to support carbon credit investment to contribute to the health fund, also interesting area that we can explore. And lastly, maybe it's not forever, we allows as the list one of the developing country, we also still need ODA or overseas development assistance to to help in healthcare sector as well. Thank you.